A very common type of injury that happens in the shoulder is an injury to the rotator cuff. The rotator cuff is kind of a complicated issue. It's actually a group of 4 tendons that originate off of the scapula and travel through your shoulder and attach to your humerus, which is the bone at the top of your shoulder here. This is an example. You can see a tendon here, which is the supraspinatus tendon, which is now torn and pulled off. Very common injury that can happen over time. Typically it will occur, as you can see, through a process called impingement. When you move your arm up and down, that tendon can get pinched between this bone and this bone, and eventually leading to a tear. Now sometimes this can occur as you fall down, you put your arm out to catch yourself, and the tendon can tear. In other situations, it's a chronic repetitive overuse injury where it's like taking a rope and rubbing it back and forth over a sharp rock, and eventually the rope frays and then it tears. Rotator cuff tears typically will cause pain at night. We're not sure why that happens, but they're very painful at night, and that's when a lot of times patients will present to our office when their sleep is being interfered with and life is not good. Treatment options include for rotator cuff tendinitis and tears from simple things like physical therapy and anti-inflammatories, and possibly some exercises for you to do at home. The next step up would be potential injection with steroids or cortisone. That can calm down the inflammation and irritation of the tendon and quite often take away the pain. The problem is when you actually have a true rotator cuff tear, quite often that initial pain relief that you receive after a cortisone injection will disappear over 2 to 3 weeks, and the pain will come back. In that particular situation, that's when we talk to patients about potentially doing rotator cuff repair surgery. The 2 most common surgeries for the shoulder are a simple shoulder arthroscopy, which is a scope to go in and remove the bone spurs and inflammation around the rotator cuff tendon, and the second being to go in and repair the rotator cuff tendon when it's torn off the bone. What that involves is a process where we put anchors into the bone with sutures that pull the tendon down so it heals directly to the bone. That process the initial healing takes about 6 weeks for that tendon to grow back in the bone. That's the period of time where you'll see patients walking around with their arm in a sling, and we keep patients in a sling for 6 weeks after surgery for a rotator cuff repair because we want that tendon to heal back nicely. The patients are going to physical therapy during that time so they don't get stiff. The simple surgery, which is called a decompression surgery, is going in to remove the bone spur, inflammation around the tendon. Those patients typically will be in a sling for 4 to 5 days, sometimes a week. They can discontinue the sling at that point. We get you into physical therapy, and generally those patients will be back to normal activities by kind of 6 to 8 weeks, whereas compared to a rotator cuff repair patient, you're looking at getting back to heavy normal activities of overhead use around 3 to 4 months. But the good news is the pain changes right away. Rotator cuffs, when they're fixed, the pain goes away. The function takes time to come back. Thank you for taking the time to watch this video. I hope it's been informative. If you have further questions, please contact us at 602-631-3161, and we'll be happy to see you in the office.